Hi, my name is Marta Zinyuk, and this is Randall. I am recording a video assessment of the head, eyes, ears, neck, and throat for NU 650 Advanced Health Assessment. Randall, do you give me consent? Do you give consent for me to do this assessment as well as record the video?
Yes.
Okay. Thank you. So I'm going to start this assessment with your head and move down to your eyes, nose, throat, and your neck as well. All right, let's get started. Your head. Okay, I'm gonna feeling your head and inspecting for hair distribution, and then looking at the shape and the contour of the scalp. I don't feel any deformities, no depressions, no lumps, no tenderness. Skull is normocephalic. All right, I will inspect your face. Your face is, Randall's face is symmetrical with normal expression, no anxiety or aggression, no involuntary movements. I don't see any edema, okay, no masses, no drooping. Nose is midline. Eyes are the same size. Okay, feeling for your temporal artery. Okay, very good. All right, the next is the eyes. Randall's eyes is symmetrical, no drooping. Okay, the eyelids, there's no swelling in the eyelids, no crusting of eyebrows or lashes. Hair is evenly distributed in reference to the lashes as well as the eyebrows. Okay, palpable picture looks good. I'm going to take a look at your sclera conjunctiva as well as your iris. Okay, I'm just going to pull up like this and then pull down. Okay. Sclera is white, conjunctiva is pink. Okay. There's no redness, no drainage, no swelling, no nodules. Look at me, Randall. Cornea, lens, and pupils are symmetrical, equal, and round. Okay. No foreign bodies, no color differences between both eyes. Okay. Palpating the right at the eyebrow bone. I'm palpating for the lacrimal apparatus. Do you feel any tenderness or pain, Randall?
No.
Okay. Next, I'm going to do the Snellen chart. So I will place it about 6 feet away from Randall. And Randall, can you go ahead and read the smallest line here?
DEFPOTEC.
Okay, very good. Can you close your left eye and do that?
DEFPOTEC.
Okay, and can you close your right eye and do the same thing?
I can't see that one, so FELOPZD.
Okay, very good. Okay, next I'm going to assess your papillary response to light. It's going to be the direct and the consensual one. So I'm going to move the light, starting with your left eye, right to the corner. Okay, and do the same thing for your right eye. And then I'm going to go back and forth. Okay. Okay. Both eyes constrict as I move the light back and forth. All right, very good. Next test I'm going to do is the accommodation test, and this is your papillary response to accommodation. I'm going to make you focus on pen light and have you move, have your eyes move with the light. So as I move it closer and away. Okay, very good. All right, and both eyes move inward equally, Randall, so that's very good. The next I'm going to do is the confrontational test, which assesses visual fields of cranial nerve number 2. And I'll have you cover one eye. So cover your left eye. Okay. All right.
Sit.
Very good. Cover your right eye.
Sit.
Very good. All right. Randall's peripheral view is intact. Next, I'm going to do the extraocular movement. And this depends on the 6 cardinal signs of gaze. So Randall, will you just follow my finger? So I'm going to start midline. Okay. Back to lateral, back to midline. Upper right. Okay. Back to midline. So out, high, middle, low. Okay, I don't see any nystagmus or any lid lag. Then I don't have a ophthalmoscope, but if I did, I would identify Randall's red reflex, optic disc, retinas, and macula. Okay, Randall. Next, I'm going to just grab my otoscope, and I'll do an assessment on your nose. Have you had any changes in any smell, any lesions, drainage, dryness, difficulty breathing?
No.
Okay, I will go ahead and inspect your external structures first. It looks symmetrical, no lesions, no deformity, no bumps, nose is midline. Okay, I will inspect your nares with my otoscope. So if you look up for me for a second. Okay. 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 Mucosa is pink and moist. Opening nicely, not indicative of any obstruction in reference to patency. Okay, I'm going to palpate your frontal and maxillary sinuses for any tenderness. Okay, so, okay, do you have any tenderness?
Nope.
And then right next to Randall's cheekbone is his maxillary sinuses. Do you feel any tenderness?
Nope.
Okay, so I palpated under, right under his brow bone and then right under his cheekbone. There's no swelling, bleeding, exudate, no polyps of any sort or inflammation, and no perforation of the septum either. Okay, very good. So next I'm going to inspect Randall's ears, but first I have some questions. Randall, have you noticed any drainage, change in hearing, any lesions, bumps, pain, any redness?
No.
Okay, very good. I will look at the surface of the ears and inspect the auricles and the surrounding tissue. Okay, both are smooth and pink, no lesions, no deformity, no lumps. Next, I will take my otoscope and look inside your ear, Randall. Okay, I'm gonna left ear, okay. Smooth, pink, no lesions, no deformity, no lumps. Okay. And then inside your ear, I will first pull it up and then back and look inside your ear. Eardrum is pearly, whitish grayish. There's some yellowish wax. Canal is the skin color. Let me check the other side. All right. Same on with the up and back. Same with the right ear. And I hold in my finger here against Randall's cheek to make sure that I don't bump him with the otoscope. Okay. All right, Randall, what I'm going to do next is we'll do something called a whisper test. And I'm going to do this by having you turn this way. Very good. And then I'm going to stand about a hand length behind you, and I'm going to cover your right ear with my hand, okay? And I'm going to whisper a word, and can you repeat it if you hear me? Okay.
Eye exam.
Very good. I'm going to do the same thing with this eye. Can you repeat after me?
Eye exam.
Okay, very good. You can turn towards me. All right, the next test is going to be called the Rhine test, and I will strike and place the fork on your mastoid bone behind your ear on the bone, and ask when you can no longer hear it. Okay, so. Can you hear it?
Can hear it. I can't hear it anymore.
Okay. Do the same thing on this side.
I can hear it now. Okay, I can't hear it anymore.
Okay. And this test is meant to test for the conduction. The ear conduction should be greater than the bone conduction, and that's what this test is meant to test for. The next, I'm going to examine your mouth. Okay, on your lips, I'm going to examine your lips first. I don't see any lesions, any lumps, any redness. Okay, and then I also have some questions for you. Have you had any problems swallowing? Any issues with your gums or your teeth?
No.
Okay, very good. Your lips, Randall's lips look pink, smooth, moist, no lumps, ulcers, cracking, no scaliness. Randall, can you please open your mouth? Okay. All right. The oral mucosa is pink and moist, and I'm just going to grab my light to assist me here. The oral mucosa is pink and moist, no cuts, no pigmentation, no ulcers, no white patches, no nodules. I'm inspecting Randall's gums and his teeth as well. Okay. Good teeth and mouth hygiene, no ulceration, no retraction, no abnormal position or looseness of any teeth. I'm just going to put on a glove to assist me here. Okay, I'm going to move your teeth around. Okay, I don't feel any looseness. No decay, no breakage. Teeth are yellowish white. Stick out your tongue for me, Randall. Okay, tongue is pink, moist. Move your tongue up and down, left and right. Okay, movement is good, no mouth odor. Okay, I will inspect Randall's pharynx. So let me just grab a tongue depressor. Okay. All right, stick out your tongue, Randall. All right. Say ah.
Ah.
Okay. I'm inspecting Randall's pharynx, soft palate, interior and posterior pillars, uvula, and tonsils. Okay, no edema in the pharynx, no swelling, no ulceration or exudate. Everything is intact. Uvula is midline, pillars are intact. There's a rise and fall of the soft palate. Tonsils are a +1, and there is no redness. Okay, very good. All right, so we went through, did a head assessment, an eye assessment. Okay, assessed your nose, your ears, your mouth, and the last thing is your neck. All right, I will start by inspecting. Look at me, Randall. By inspecting your neck. Okay, look at me. Your neck is symmetrical. There's no masses, no scars, no enlargement of glands or visible lymph nodes. I'm going to palpate some of your lymph nodes, and I will start with your periauricular, which is right in front of your ear, okay, with 2 fingers. Do you feel any tenderness there?
Nope.
All right, right behind your ear is your posterior auricular, okay, right in the back of, at the base of your scalp, for the occipital. Moving on to the tonsillar. Any pain?
Nope.
All right, then mandibular, submental, which is right under Randall's chin. Okay. All right, cervical, posterior cervical, which is all the way in the back here. And then superficial cervical, turn to your right. Okay, deep cervical. Okay, and then the supraclavicular, which is above the clavicle. Okay, thing is mobile, non-tender. Okay, Randall, move your head up, down, right, left. Okay, range of motion is good. I'm going to palpate your trachea now by moving it. Look up for me. By moving it side to side. Okay, trachea is not deviated. Okay, I will go ahead and palpate your thyroid. Can you swallow for me, please? Okay, no lumps, no nodules, no tenderness, no bumps. And last but not least, I would like to test your sense of smell. So what do you smell here?
Sounds like apple juice.
Okay, very good. It's apple juice. Okay, Randall. That completes our assessment. Thank you.
Thank
Thank you.